Hi class, I hope everyone is having a great week 5. For this week's topic for community practice assignment on the topic of coercive mental health care. This topic is one of the more sensitive issues specifically for me just because of the experiences and just familial relationship and stuff that I've witnessed, especially with the healthcare for my family. And so, yeah, I just wanted to discuss how coercive mental health care for people with psychosis is um, uh, terrible mistreatment for the patients. Um, and yeah, with this source that I found on National Library of Medicine, specifically with psychiatry, there was a lot of coercive acts with patients done by psychiatrists, especially with medication, prescribing too strong of a dose that affects their short-term and long-term health, and coercing these medications onto them, which is extremely dangerous. And of course, it violates the patient autonomy and their independence on what to do for their own mental health. And most times, people with psychosis really have no choice or just very little willpower to uh, determine their own life. And so they usually just listen to their psychiatrist and unfortunately listen to the coerced, be a victim of their coercive healthcare. So yeah, developing more on the issues with psychosis with for the patients. This is really important to me, like I said, because of my familial relationship, um, especially with my uncle, who has been diagnosed with schizophrenia and bipolar disorder, and many of the medications I've seen him take are mostly under him not knowing what they do, what the medications do, or the purpose, or even just the purpose or the treatment of it. It's mostly just being told what to do by their healthcare professional and just listening to their orders. So there's a lot of ethical considerations, especially um, just like I said earlier about the patient's autonomy, really, really unethical, morally. Human rights are violated, of course, and like I said, the potential for harm on the human mind and the brain is very dangerous and poses a serious threat. And as a therapist, I definitely want to avoid providing these coercive mental health care. I treat, I will treat all my patients with extreme sensitivity and making sure that each side is understood and not me just forcing and imposing my directions and my guidance onto them, but to have it be a mutual understanding is how I would process and go about, especially with myself of the therapist. And so all these ethical considerations, even confidentiality is affected too. Um, and I just feel that all these treatment pressures are all very inhumane and forcing patients to do something because of a professional being in a higher status and being in a more powerful position than the patients is just very immoral and incorrect. And so this is what I definitely preach and want to emphasize as I become a future therapist in the marriage and family field. Thank you.